Good morning, everybody. My name is Dr. Dick Walker. I'm sitting here on a snowy morning in Spokane, Washington, United States, and we'll be chatting this morning with Dr. Duane Starr. It's December the 18th, 2021. And I think you're going to enjoy hearing some words of wisdom from Dr. Starr. He's I guess I would describe him as a much more than your neighborhood dentist, but he's also that. He's a holistic dentist. He is a leader in implant dentistry, does some very interesting stuff. He's also, he and his wife Val have also become good friends of ours. So, Duane, why don't you kind of give us an idea of who you are, what you do, and then I'll ask you a few questions regarding the Redox solution that comes in the blue bottle. It's sitting on the shelf behind me. So Duane, you're on.
All righty. Well, thank you very much. And welcome to everybody that's joined us this morning. I am a product of Oregon Health Sciences University School of Dentistry, a 1984 grad. I've been around a few times. I enjoyed initially learning in my career about implant dentistry. I bought into an unusual practice. It was a oral surgeon, and here I'm a general dentist buying an oral surgeon's practice. So I had some big boots to fill, and Dr. Collins told me to get involved with a national organization, the American Academy of Implant Dentistry. And so I did, and that has started a 30 some odd year journey with that organization. And today they call me honored fellow and a diplomat of the American Board of Oral Implantology. So that's more or less the professional side. I also have enjoyed doing gold, and that's part of my restorative excellence focus. So those are some things that I've focused on in my career. And I'm also enjoy motorsports. So I'm a partner in an Oregon Raceway Park, and look it up. It's the best kept secret in Oregon, I think, still. So
yeah, you like to go really fast around a little circle, right?
I do. We have a 2.3 mile track with 400 feet of elevation change, and it's been called the gnarliest track on the West Coast by Motorcycle Magazine. So it's
interesting.
It's a passion of mine, and I've enjoyed working on that project in my spare time over the years.
I think that's one of the reasons why we, I share my love of the risk sport called mountaineering and rock climbing, and Duane likes to go really fast in his one of his race cars. So Duane, how did you first become aware of the ASEA Redox, and what were your first impressions when you first heard about it and started to learn? Because I know you've dug pretty deep into the technology, but go back, a few months back, and how'd that happen, and what was that like?
Yes, well, we probably from alpaca circles, from talking to you, Dick, we had begun to take ASEA, and I think my wife noticed more changes in her arthritic symptoms than I did. And maybe I wasn't as consistent with it in the early days, but 3 years ago or so, a little over 3 years ago, we decided to move from Portland. So we lost our consistency with ASEA for a while, and picked it back up several months ago. And my wife's, her creakiness, as she calls it, her creakiness is better. I sleep better, I think, is my main benefit that I'm experiencing right now. But there are other benefits too. So I just, we picked it up out of necessity, and thought we better get back into this. And so we did. But this time I think I found a deeper understanding of what ASEA is doing. I've been teaching in my other spare time with a group that we have a dental implant continuum. So we've been teaching, I think this is our 13th year. And one of those years, we brought out Dr. Ed Cusack from South Dakota, and he brought 5 laser companies with us. So one of those companies was Thor Laser, and it's a cold laser. And I was fascinated by this PBM, as they call it, the photobiomodulation that most lasers can have a mode where they can do that. So I've delved into that, took some courses, and begun to understand how the red light would affect the mitochondria. So I began to see the effects of the red laser, and then I became to understand, after talking with you, Dick, and Dr. Osler, about other aspects of the signaling and the control of important control of antioxidants that are so critical to maintaining our homeostasis, keeping us out of an oxidative stress. These are buzzwords to some of you maybe, but they've become concepts to me. So having a deeper understanding of the mechanisms now has really been a paradigm change for me. So I don't know that.
Yeah, that's interesting, because I remember I connected you on, it's been months ago, with Lee Osler, Dr. Lee Osler, who has written the book Redox Matters, about redox. And I just got you guys talking, and it wasn't long before you and Lee were talking about some biochemical stuff that was, at that point, was a little over my head. I mean, because I was just learning about transcription factors and the effect of redox. And so it's interesting. Quite frankly, I was pretty surprised that a dentist knew as much about cellular biology when it comes to redox signaling. You and Lee were kind of at a different level than I was at the time, and I suspect that was because of the information you were learning with regards to your laser, because there's some real symmetry and crossover there, I think.
Yes, I think so.
So you took it just as an individual because you'd noticed a couple of years ago that it was helping. You wandered away from it because you were, quite frankly, very busy moving a practice from Portland to Prineville, from a big city to a small town in Central Oregon. And then you restarted because you realized you were missing it. You were not feeling as good, not sleeping as well. But then you, a couple of months ago, I think we were having a conversation, and something clicked. And next thing I know, I'm down at your clinic, and we're educating your staff, and you're telling stories about what redox is doing. And and now you've really taken a big interest. But what was it that kind of took you from a satisfied consumer of redox to wanting to more actively promote it? What happened there? Kind of explain to folks, because I think there's a lot of folks on that will want to maybe share with their dentist your thoughts in that area of why get more involved with this.
Well, building on some of the blocks that Dr. Osler and I had talked about, I had a case that I knew was going to be a challenge. And quite frankly, I talked it over with the patient, and we decided to have him start on ASEA right just at the time of surgery. I don't think we even pre-dosed him with any ASEA, but just post-operatively have him swish and swallow. For years, I've been a big proponent of just regular salt water. I've said the phrase quarter teaspoon of salt and 6 ounces of lukewarm water thousands and thousands of times. So it wasn't a huge leap to understand that ASEA could take the place in that post-op healing there. And frankly, the case that I'm thinking about had some very difficult suturing to accomplish because of the way the implant was with the soft tissue. And so this complicated suturing, it just looked beautiful at the next post-op. And I was very pleasantly surprised because this patient wasn't as compliant as, I've known Jeff for a long time. So it was just results beyond my expectations. And so then I started doing it with some other cases, and it's just built on that. And then serendipitously, sometimes they would tell me of good unintended consequences. We've had one patient tell us that her IBS symptoms went away, but so I don't know what to say about that. But most patients are very compliant with this, and they salt water is, it's not the tastiest thing in the world, but they take it as their post-op treatment. And so just serendipitously with periodontal patients, we started trying it with some periodontal patients, and we're just finding some other interesting uses clinically. And our motto, of course, is first do no harm. So we're very careful in how we look into things and proceed and do things based on sound concepts. So that's been a very pleasant surprise. I don't experiment with patients. I do everything I possibly can. So we're using laser treatment. We're using biologics. So we often draw blood and separate the blood between the red blood cells and the plasma. And we're wanting to concentrate the platelets. So as we're understanding the concepts of cellular healing and cellular communication, I can't help but think there may be bigger roles yet in how we're doing our bone grafting and some of those. So that's sort of a leap into the future, Dick. I'm not there yet, but I think we will be.
Yeah. So I just want to remind folks, don't get the impression that we're curing, healing, or treating anything with this, but it's interesting that you made the switch from swishing and spitting salt water to swishing and swallowing ASEA, this very much modified, saline that's gone through a proprietary process to turn it into a signaling molecule solution. But ASEA, it's a tool that the body can use to do some amazing things by improving cellular communication. But again, we don't want to imply that it's curing or treating any of these nasty dental problems. But it's interesting that you had somebody do that, and then you noticed that the repair procedures that you'd done, which I think, quite frankly, you shared with me that you went home a little worried that night about that patient, whether that complicated, fancy suturing job that you had done was actually going to work. And I can tell you, back when I was in the ER, I remember, and this was before ASEA, I can remember doing some of those on people in the ER, not in the mouth, but on the skin, and wondering, gee, is that flap going to survive? What's that thing going to look like in 3 or 4 days? And of course, as an ER doc, we never got to see it because they went to somebody else for follow-up, but we usually did hear if the outcome was bad. But so you tried it, and you were impressed with what the body could do with this.
Yeah.
And now you're sort of even, I think, a little more deeply interested in this, even from a business standpoint. Was that another switch, or was that just sort of a continuum of interest because you saw what it was doing? Because you're definitely more interested and more engaged and involved now than you were a couple of months ago.
Right. No, there's my first interest is the scientific and healing abilities, or controlling inflammation. Dentists live in the world of inflammatory processes. That's pretty much where we live. And there's good inflammation and there's not so good inflammation. And being able to guide the body to good outcomes, controlling inflammation is much of what we do. in terms of implant dentistry. So there's other ways to help people too. Financial issues are financial issues, and I have taken a look behind the curtain and seen the business possibilities, and so that's just another way to help people. I am a kind of an adrenaline junkie in some ways.
You are definitely one.
But I think mainly, I was put here, most of us were put here to help other people. And as I think Zig Ziglar said, when you focus on helping enough other people get what they want and need, you'll get what you want and need as well. So that's the focus, Dick. And so whether it's a financial issue, I mean, people are in financial straits, as well as tough dental, broken down dental states. And so people just need to be met where they are in so many different ways and see how we can help them. And so I find myself helping people more and more outside of the traditional envelope of general dentistry. I do a lot of surgery, and implant dentistry. We have a slogan that says implant dentistry is a restorative discipline with a surgical component. So we have both sides of that, and ASEA can definitely help patients in the surgical phase of that, is what I've seen. But I'm very interested to see how it might help them in their maintenance phase of things. And I think, based on the principles that I now am understanding, I think it very much has a role to play in the long-term maintenance of, when patients put a lot of money into restoring their mouth, they want a long-term outcome. So we're used to giving them guidance on how to clean their mouth and the devices that they use. This is just another tool that I think can be very, very effective in helping patients with their long-term outcomes, as well as getting them through their acute inflammatory, post-op surgery. It's not fun sometimes, but it can definitely.
So the maintenance and prevention of ongoing, or the worst thing that can happen is you spend hours in somebody's mouth, and they spend hours with it wide open and spending lots of bucks, and then have them just be back to where they started in a couple of years because of ongoing chronic issues that they didn't address or weren't able to address maybe before this came along. So yeah, that's what I call long-term thinking, and certainly to the huge benefit of the people that you take care of, who might not otherwise ever hear about this, and how much it could help them. So you explained that one person that kind of originally really got you sort of impressed. Any other issues that really stand out without it sounding like we're treating or curing? Any other things that you've seen now that you're kind of getting more people introduced to this?
There's just a plethora of various things that I've heard that have improved for patients. The common theme is just energy. One of my plumber patients, I've seen him work. He did the work on my building, and he goes, and he told me that after treating some of his dental issues, he was noticing his energy level in the afternoon was quite significant. I mean, it was enough for him to notice and wanting to be consistent with taking ASEA.
Yeah, that's interesting. Plumber, I don't think of plumbers as being the most someone who would really notice something like that might be a little bit more subtle than some of the other things we see that the body is able to do at the ASEA. But we certainly see a lot of people. In fact, that was one of the first experiences that I notice. As you know, I'm a physical fitness nut, and what I noticed, and actually Nancy had to point it out to me. I went from working out once a day to twice a day after I started the ASEA, and I really didn't initially attribute that to the ASEA. I just thought all of a sudden I'd gotten more ambitious, but I couldn't have done that. In retrospect, there's no way at 65 that I could have started to do twice a day runs and that sort of thing without the support of Redox. So what about, are you using it? Are you recommending it to patients who maybe don't have the best control of inflammation in their mouth before you start to do major restorative work? Are you doing that? Are you doing that sort of thing with them?
Absolutely, that makes total sense. And we're often doing things to prepare a patient for surgery, because often they don't present ready for surgery. So yes, and after reading some of the abstracts at the ASEA Science, I'm understanding that will help bring their levels of inflammation down. Many times we have to put patients on an antibiotic or some other drugs before we can even get in there and treat. So this would be a part of that picture. Yeah.
Okay. All right. So if there's a dentist watching this and wondering if they should engage with Redox in any way, what's in your opinion, what would be maybe the most important thing for them to understand going into this?
Well, I would encourage them to do some research. Dr. Hostler's book, Redox Matters, is a great place to start. But there's PubMed, and do some research on Redox, and get it in your mind really how this is working. And it's a paradigm shift. And I think that just spending a little time back in your biochemistry days, I know that many of us thought we left that decades ago, but here it is again. The Krebs cycle's back. And so get into it, get into the biochemistry, convince yourself of what it's doing for you and your patients. Try it yourself, doc. I'm talking to you docs out there, and do your homework, and then you'll find cases. You'll find the cases where you can help your patients. So that's how I approached it, and I think it's a good road.
So, doctor, heal thyself, right?
Well, it does begin there. I think you have to be convinced of what it can do for you before you can help.
And that was certainly part of your progression. Was you and Val were using this on and off for a couple of years. Mm-hmm. I think before you ever probably recommended it to anybody else to try it. So.
It's affecting inflammation in a good way, and I've been reading some papers on the different pathways. The NFR2 is the good one, so you want to stimulate that, and that helps glutathione and some of the other secret. They're not secret, but they're really wonderful intracellular antioxidants. Superoxide dismutase and catalase. Those are the ones that we learned way back in dental school. And this is how they can be controlled. I very distinctly remembered in histology 1 billion years ago that we knew cell communication happened, but we didn't know how it happened. And there was a lot of theories, and they've turned out to be maybe not so viable now, but it's interesting. Now we know, we think we know how we get things talking properly. And so it's exciting to me. Some of my colleagues and my classmates are winding down, and I'm just as excited as it can get and not ready to hang it up at all. So I think this is a real fundamental paradigm shift. I think that we're going to see more of it in medicine and dentistry. Concepts that will change based on this type of medicine. And
Yeah.
I mean, I know all the rules. We're not supposed to say certain words, but sometimes I don't follow the rules. Right?
Yeah, well, you're doing a pretty good job this morning. We need to do that so that we can make this recording available so that everyone
Yes, and I want to.
can share it with their family dentist if they want to, or the dentist who works at an academic center. This is powerful stuff.
It really is.
Yeah, and the
Paradigm
science.
shift, I think, is the best way I can say it. Yeah.
Absolutely. That's a really good way to put it. And I'm right with you there with mitochondria and Krebs cycle. I thought I was done with that once I passed the test in pre-med, and then again in medical school. I just thought, shoot, I don't think I can remember the exact thought process in my head was that I'm glad I don't have to worry about that again, because certainly as an emergency physician, I don't think I'll ever have to worry about the Krebs cycle and mitochondria. And I've fallen in love with the Krebs cycle and mitochondria as I've started to investigate this and realize how important they are.
Right. And it's just fascinating how things can, toxins and environmental things can plug that cycle up. And so we need things to unplug it and make it work better. So I think that's where we're at right now.
I think you're right. And, I love Dr. Osler's concept of the inner doctor and how important it is to feed the right ingredients into that mechanism so that our body can do a much better job of what it already knows how to do. So yeah, fascinating, and yet totally safe, totally natural, bioidentical, if you want to use that term, bio-replenishing, some buzzwords. I do want to make sure that those of you who are watching who are not healthcare professionals and simply are looking for a little deeper understanding of this, that you don't have to understand all this science stuff that we're talking about. You don't have to really worry about your mitochondria or your Krebs cycle. All you've got to do is drink and see it. and it can help. Yeah, just let those molecules do what they know how to do, and let your body use them in ways that it knows how to do without any education or prompting or anything. So we're kind of approaching the bottom of the half hour here. Any other words of wisdom or advice that you'd maybe like to pass along to health professionals that are looking at this, dentists or anyone else?
Well, when I see somebody in need, and I'll, as dentists, we have to put things at the chair side, very complex things sometimes. You have to explain it simply. And so my little thumbnail description goes like this, that I'm told that from birth to adolescence, our body knows how to make enough switches. And these switches are what's critical to turn the proper things on when conditions change for us. Well, after adolescence, we're not producing as many switches. And at about 1% a year, 10% a decade, we're losing our switches. And so this is a way to maintain the switches in our bodies to promote the homeostasis that our body craves for health. And so that simple description gets their attention. We can do a deeper dive into the science, or if they said, okay, doc, I'm good, they just go with it there. But that's how I talk to patients, and just try to meet them at their needs and encourage them to give it a little try if it's something that I think we need.
I just looked at the chat, and somebody was asking, how do you get to be how do you manage, how do you make it available to your patients? What do you do there?
Oh, I let them buy it from us retail. Sometimes in some of our procedures, we're bundling it in the procedure, so I can just not have to separate that cost out. So I have a really great office manager who takes care of that and sorts that out. But most patients are very happy to make a purchase of it, and then if it's something that they want to continue with, and we help them get it on a shipping kind of, at a lesser cost and more convenient for them. So that's how we've done it so far.
So basically you have some there, you get them started with their first, maybe send them home from the office if you've done some surgical procedure on them with a pouch or a bottle or whatever.
Absolutely.
Now what we're doing is monthly.
Normally they
clinic for those who want to learn more and for those who want to become ongoing users, that option is there for them.
Yes.
Wonderful. Well, I think my internet's starting to act up, but we're at the bottom of the hour. Yeah. Dr. Starr, I want to thank you very much for spending a half an hour here with me this morning, talking to people around the world about redox signaling and how it fits in with dentistry and, even I would say the cutting edge of dentistry with restorative and implants and all that stuff. So thank you very much, and have a great day. And we'll be back again the first Saturday of January. I think that may be New Year's Day. So watch your texts and emails. We may push that back to the second Saturday because I don't know how many people are going to be bright-eyed and bushy-tailed at 8 a.m. on New Year's Day. So thank you very much, and have a great weekend. Have a great holiday, everybody.